Hello, I'm Karen Hopkins, an associate professor in the School of Social Work at the University of Maryland. I will be interviewing Dr. Howard A. Palley, a co-author of a recent book dealing with the Canadian provincial healthcare delivery system. The book, titled The Political Sustainability of Healthcare in Canada, Private Sector Involvement in the Federal Provincial Healthcare System, was published by Cambria Press in September of this year, 2012. It's co-authored by Professor Emeritus and Distinguished Fellow Howard A. Palley in the School of Social Work at the University of Maryland, Associate Professor Marie-Pascale Pomey, Department of Health Administration in the Faculty of Medicine at Montreal, at the University of Montreal, and Mr. Owen B. Adams, Vice President for Health Policy and Research in the Canadian Medical Association. Good morning, Dr. Palley.
Good morning.
My first question is, why did you and your co-authors decide to write this book?
Well, globally, the mix of private and public sector involvement in healthcare delivery is a focus of political and public policy concerns. Little has been written about the how and why public policy developed in this case. We decided that a comparative case analysis of this development, comparing the delivery of healthcare in 3 Canadian provinces, Alberta, Ontario, and Quebec, would shed light on the developing public-private partnerships.
To provide a little more background, can you describe the Canadian healthcare system briefly?
Canada is a complex healthcare delivery system, which is a conglomeration of 13 public plans, 10 provincial, and 3 territorial, as well as a number of federally administered plans serving special populations, such as Aboriginal groups and veterans. Under the Canada Health Act, all citizens and most residents are provided full coverage for most hospital and physician services, as well as other coverages for many healthcare services. Other than physician and hospital coverages, other coverages vary among different plans.
Why is this study important?
The importance of this study is that it examines how the public-private relationship in healthcare delivery, particularly that of the for-profit sector, has developed both historically and in recent years in 3 subnational provincial jurisdictions within the federal system, and that is in Alberta, Ontario, and Quebec. Our study examines both similarities and differences in this development. These provinces are highly distinct in their political culture and the political history affecting healthcare delivery. Ontario and Quebec are Canada's most populous provinces, and Alberta is an increasingly populous prairie state. Alberta is unique in its long-time governance by the Progressive Conservative Party and its predecessor, the Social Credit Party. Ontario has had a more variable political history, with periods of Progressive Conservative, New Democratic Party, and Liberal leadership. And in recent years, Quebec's governance has shifted from the Parti Québécois, between the Parti Québécois and the Liberal Party. In our study, one dimension that we examine are political dispositions to act regarding public-private initiatives in healthcare delivery, and how these political dispositions affect healthcare delivery in the provinces.
Are there any national constraints on the actions of the provinces with respect to the delivery of healthcare services?
Yes. Provincial and territorial medical and hospital plans are constrained by the Canada Health Act of 1984. For necessary medical and hospital services, there are no extra billing or charges. Also, provinces and territories must adhere to the Act's 5 principles. These are public administration, comprehensiveness, universality, portability, and accessibility in order to receive full federal funding for insured services. However, other healthcare and healthcare-related services involve federal contributions that are not constrained by these principles, although they're subject to reporting obligations. Another factor providing some flexibility in provincial Medicare plans is that necessary and hospital and medical services are not enumerated in the Canada Health Act. This allows some delisting of services, which is discussed in the case studies.
That is very interesting. So what's unique about this book?
In this book, in the Provincial case studies, we examine how the federal-provincial dynamic has worked out in 3 provinces with respect to similarities and differences regarding involvement of the for-profit sector, both within and outside the 3 provincial Medicare systems. We also examine how the national and provincial fiscal setting has affected both economic and political sustainability pressures, which lead to private commercial initiatives in the 3 case provinces. In addition, we also note that these initiatives occur both within and outside the Canadian provincial Medicare systems, and there is a need that such initiatives be held to a standard of public accountability in order to meet equity and adequacy goals.
What other research do you believe is needed in this area?
Other subnational health policy studies in federal states such as Germany, Australia, Brazil, and India are needed to examine further these federal subnational relations.
Thank you very much, Dr. Palley. Good luck with the book.
Thank you.